All right, Dr. Morse, I'm recording if you want to go ahead.
Okay, welcome everyone. While I get my screen sharing up, I will just mention that we do know that there is a press conference today with the governor at 1:30, but we did check and confirm that there will not be anything new that is school related shared today. So I will not talk overly fast like last week because again, I don't think there's any reason for us to try to be done by 1:30 today. So, because after the week we've all had, I'm sure we don't need anything new for the schools this week. So just as a reminder, if you're not a school-related employee or staff member or with the health department, we'll have you just jump off so we have time for everyone to utilize this time. But this information will be on the health department webpage. So it will be publicly available, and just make sure and pass all the information on to all who need it. Breaking news, you may have heard this. It was just posted on the CDC website yesterday. It's buried though on the clinical considerations after vaccination. So it's on one specific site. Although I just was peeking before Janine said she was starting the recording, it looks like they're have updated the quarantine page 2 of the website. I have to read through it a bit more. So they're in the process of getting this other places, and we're very, very confident that the state will also make changes to their recommendations and the advice they give people when they're doing contact tracing and things. But the wording now states, this is copy and pasted right from there, that vaccinated persons with an exposure to someone with suspected or confirmed COVID-19 are not required to quarantine if they meet the following criteria. So they have to be fully vaccinated, which that means that you're 2 or more weeks after getting your second dose, if it's a 2-dose series, or 2 weeks or more following a 1-dose of a 1-dose series. So for example, we expect Johnson & Johnson vaccine to come out soon, and that's a 1-dose vaccine series. So you're 2 months post the full series of whatever series you got, and it's within 3 months following that last dose. As we go further and further in this pandemic and they have more evidence, hopefully that 3 months will keep getting longer and longer, but for now it's just 3 months. And you're not having any symptoms since you were exposed, obviously. If you don't meet those 3 criteria, then you do still need to quarantine. So this is very exciting, especially since we're getting more and more of your staff members vaccinated. So that'll hopefully help a lot with your staffing as you have cases in the school or as they are exposed to cases out in the public. We want to be careful how we're presenting that though. Doesn't mean that they should test that theory by not wearing masks or going to parties or, doing things that might test that, because again, we don't have evidence really to know about asymptomatic transmission or things like that. So we still need to be cautious, but this should at least be a big help. Another thing that I've noticed is on a lot of news pages today is talking about how the CDC is now recommending double masking. That is not what the CDC is recommending, and I'm going to go over that here for you. But this is a study that came out just this week, so February 10th. They did a study, and I'm going to show a little bit more here in a second, using test dummies. So they basically, and I have another picture here in a second, but they stick a tube in a dummy and they pump little particles through it. And one of the ways that they did this was by using 2 masks, but it basically looked at how well a surgical mask fit and how well it prevented these particles from transmitting from one dummy to another. And this next slide here shows that. So here in picture A, you can see how there's a big gap in those surgical masks, and we all kind of know how some of these masks do gap. Picture B, the way they solved it was by putting a cloth mask over the surgical mask. getting some feedback. Picture C, they solved it by tying a knot and then tucking that extra fabric or cloth. I'm sorry, material, I guess I would say, it's not really cloth. But they fixed the gapping just by tying it. And if you look down here at these bar graphs, the middle one here is using 2 masks. The bottom one is tying a knot in it and tucking the extra material. The bottom bar, the littlest bar, is if both dummies are wearing a mask. And you can see that whether you're wearing 2 masks or you just tie a knot in it to cinch up that gap, and both the person breathing out the particles and the person kind of receiving the particles are wearing a mask, your protection is the same. So however, how media sometimes take it is that, gosh, you need to wear 2 masks. No, you don't. You just need to make sure that there's not a gap there to get your best protection.
Dr. Morse,
yeah.
It sounds like several people for some reason cannot see your presentation. I can, but in the chat, there's a lot of them that say they can't see it. I don't know if that's on your end.
Okay, let me try. Thank you for telling me, because I can't see the chat when I'm doing that. So let me stop sharing and let me just go to, okay. Sharing is paused until we return to the sharing window. Okay. Can you guys see it now?
I just see JM at the circle.
Same here.
I could see it earlier, and now I can't. I shouldn't have said anything.
All right, let me.
There.
Okay.
Yeah, it's there now.
Yep.
Okay.
You can't see it.
Remember, what's that? Did someone say they can't see it?
No, I was just saying, if anybody can't see it, please just chime in. But I think we're good now. Thank you, Dr. Morse.
Okay, yep. I'm just sharing the PowerPoint, so I'll have to make sure when I show the data, I might have to monkey with it. This was a slide I meant to delete because I put it somewhere else, so just ignore that. So this is what's in the CDC in layman's terms from that study. So again, it's not saying to wear double masks, but how to improve your mask protection, and there's also a more detailed explanation on the CDC too, but basically just try to make sure it fits snugly against your face and make sure there's enough layers that it will stop transmission. So it's pretty much the same as it said in the past, but now it has, just occurs to me, I'm going to show these pictures again since people couldn't see it, but this is what it was showing. Worst thing is if you have a mask, and again, it just looked at surgical masks, but if you have this gap here, and the ways they solved it was either to put another mask over it or to tie a knot in it, and both ways work equally well. Okay, so cruising up ahead. So what they recommended was try to use a nose wire to stop gapping up at the top. They suggested using a mask, fitter, or brace, which I'm going to show you here in a minute, as one way to stop the gapping there. But again, tying a knot worked just as well. Just making sure that it fits around your ears and around your mouth and chin. Use enough layers, whether it's having enough layers of fabric. They also talked about using a second mask just to hold it against your face, making sure you can still breathe okay. And then again, tying the knot in it as a way to hold it against your face. And there is a video here that shows you how to do that. Don't wear 2 disposable masks together. And if you use a KN95 mask, which is, it's the Chinese version of an N95 essentially, which you can buy online. I looked on Amazon today, they're a little over $1 a piece. You don't need to layer those. So this is what they're talking about with a mask, brace, or a fitter. This is silicone. It just helps to cinch it tight to your face. Again, you can just tie a knot in it if you need to. You can twist this so that it's cinched up against your face. I also found online that there's little, because nursing staff have had to do this for a year now, so there's all these little do-it-yourself tips that they've come up with, using rubber bands, using rubber sheeting, using another surgical mask and just cutting it, and again, tying the knot in it. So again, if you're seeing headlines saying the CDC recommends wearing 2 masks, they really are not. They just recommend making sure it's tight against your face. As we've talked before, I don't feel like you need to be checking everybody at the door and being a real stickler about masks. But if you're seeing kids that have masks, or your staff that are just really, really sloppy and completely, going to be completely ineffectual, you may want to talk with them or see if they can cinch them up a little bit. There had been a question that had been brought up, the frequently asked questions that go along with the executive or the epidemic order previously had an error in it. It said, in regards to non-athletic extracurricular activities, it said that it allowed musical instruments, but it said that slip masks were not allowed, which kind of makes it hard to play musical instruments. And there was guidance out there that they had put out in October that was contradictory to that. And so that was taken to the state level, and they have fixed that. So just wanted to draw your attention that that has been fixed. They do now say slip masks are permitted when students are playing their instruments. And then the link goes to that guidance, which explains all the different things you can do to safely have performing arts in your schools. We did have a question come in about pep band at indoor sports, and I asked the state about that, and they said there's no pep band allowed at this time, which makes sense with all the other restrictions we have right now with gatherings and things at sports. So some of the changes, the applicable changes in this epidemic order that is in effect until the end of March, unless a new one is posted, they added some specific definitions about contact sports competitions, non-contact sports, and practice. So those definitions are in that order if you need them. Section 6 is completely different, and that's where you'll find that contact sports, practice, and competition are prohibited unless the participants remained masked, or if it is unsafe to be masked. They're following the testing guidance, which is in the guidance for athletics, which we'll talk about, that they remain 6 feet distance when they're not engaged in play, that the gatherings follow the gathering rules in section 3, which is the same as it has been, and that you follow all other rules in the order. Oh, and then the testing is required for those who can't safely wear a mask at times, but any other sport that has to be masked can still participate in the testing program. So anything you need to know about sports at this time is at michigan.gov/sportscovidinfo. That has links to everything else, including a link to the interim guidance for athletics. So it discusses overall kind of the risks associated with sports, and has a link to other documents that talk about that, and has just good information and references there if you need them. So all athletes must wear masks at all times, except when they can't be worn safely. So that is during competitive cheer, when they are tumbling or doing stunts or flying, gymnastics while they are on different apparatus, during a wrestling competition or during actual contact of wrestling, and then during water sports while they are in the water. So there are no other exceptions. There are no medical exceptions. It's only during the times when there's hazard to that. If there are questions about that or concerns, there is an email you can post those to, and I'll share that in a minute. Everyone else, coaches, staff, spectators, everybody else must have masks at all times. The individuals who are unable to mask at times due to safety must So for the 2 weeks before and after they are unable to mask, which is really all the time because you have practice and all of that, should completely avoid participation in non-team social gatherings. And that should be strictly enforced by team staff and coaches. So these are statements I've copied and pasted from these interim guidance. So your coaches are supposed to basically be keeping your athletes from having any kind of get together that's not family and team, which I know is a challenge, but basically because if they're going to get COVID, it's going to be from these gatherings. So I just add this here's A is my, and that's why I said I, because this is my own wording here. Really do encourage that for all sports because in the fall when we've had issues with outbreaks in sports or related to sports, it's really been, COVID that's been community acquired and then spread not so much during play so much, or at least the big outbreaks have been really related to like pre and post game meals, banquets, parties, social gatherings, bus rides, car rides, locker rooms for the most part. It's hard to prove exactly where it is, but there's been parties or things where you worry that that's where it's been a big issue. So in order to keep sports going, try to encourage as much as possible safe activities or, avoiding the less safe activities. So for those activities where they can't safely wear a mask, they have to have a negative rapid antigen test within 24 hours prior to not wearing the mask, or a negative PCR test within 72 hours prior. And if they have had a previous confirmed case of COVID within the past 3 months, then they don't have to test. And for any sport and any student or anybody really, obviously if they have symptoms of COVID or they've tested positive or they've been in close contact with somebody with COVID, they need to follow the normal isolation and quarantine guidance. So this is a link once we send out this PowerPoint, but this is a link that's within that website the sports COVID info website. It's at the bottom of that page. This gives you all the information you need to do your testing, to get your test kits, to train, to sign up, to report results, everything. It has a frequently asked question document in there and the links here. That I found, if you have any questions at all and you can't figure out the answer, look there because that's where you're going to find your answer. Again, there's a link where you need to report all your test results. Really, everything goes through this and through MDHHS. We are not involved in it at all. If there is a confirmed positive case, then we do need to know, just like with any other case, but otherwise everything is managed through the state. And again, if you have questions about any of the rules, any of the testing, even though this looks like it's only about the test and the testing, if you have questions about the rules at all of those questions go to this email address. Travel guidance, we talked last week and we've kind of been talking all along about travel, and now it's been pretty much a uniform recommendation now that if there's any travel, the CDC is recommending a quarantine and testing afterwards. It's kind of hard to know what really is travel. And so I have talked with some of the heads at MDHHS, and they are going to create guidance for this. And so I'm holding off on putting together anything because of that. So I'm just asking that if you can, to just hold tight. If you do have someone that has more concerning travel, say to Florida where they have a lot of variant cases or anything like that, if you need any guidance, let me know. But again, right now we're trying to hold off on making any specific recommendations, hoping that we'll get some uniform recommendations at a state level so that we all have the same recommendations rather than having different ones county to county or health department to health department. So, all right, so I'm gonna pull up our data here. My hunch is you probably can't see that. Is that correct?
Just says review of data, so.
Okay, so let me switch screens here. All right. So you should see or should shortly see
Yep.
the data here. Great. So we continue to get better. This is very exciting to keep getting more variability of color here. So the state average of cases per million went from 165 to 129 over the past week, and the percent positivity went from 5.1 to 4.2. Here are the counties in Central Michigan District Health Department. We went from an average of 165 per million to 128, and our percent positivity is hanging steady right around 5.5. That's, to me, that's always been a tricky one to really use as an indicator, but still, if you look at the trends, the majority have been following the right trend. The counties of District Health Department 10, you can see, you know, we've got some here who are getting down into the high category, which, you know, in the beginning that was awful. Now it's wonderful to get down to C. That's a great letter to be in. Their average went from 155.8 per million to 123.1 per million, and the percent positivity went from 7.4 to 5% positivity. And then the three counties of Mid-Michigan District Health Department went from 130 to 127.5. You know, I know Montcalm and Gratiot, you know, their numbers at one point were way up there. So it's just, again, really, really encouraging to see those numbers come down. Their percent positivity on average is at 2.7%. So again, really coming down. So we will share this with you, and I will flip my screens again. Maybe. Oh, where is PowerPoint? Okay. All right, so I should be back on my PowerPoint now. Let me know if anyone can't see that. But this is the statewide overview of data. The state as a whole, in terms of cases, are down 81% from when we had that peak in November. So we continue to go down. So hopefully we'll continue that trend. Our hospitalizations are down 72% from when they peaked in December. Our death rates are dropping. We will talk about the variants here in a minute, but overall, things continue to improve in Michigan as a whole. Here are the statewide trend for positivity, our daily cases per million, and hospital rate. They have that gray bar there again because this goes by date of onset of symptoms, and so there's usually a delay because until someone gets diagnosed, we don't know when their onset was, so it could be a bit delayed. This is the hospitalization trends for the state. This little inset here on the bottom right, on the far left, that is where we began in March, April. So we're getting closer to where we were over the summer. So again, let's hope we keep improving. This is our average test turnaround time. For commercial labs, it's close to 3 days. For our hospital labs, it's just over a day turnaround. So our lab turnaround is doing very well. So for the variants, the B117 variant is the one that's come from the United Kingdom. The case counts continue to rise. It's been reported in 33 states, 690 cases total. Again, Florida and California are two states that really have quite a bit of it. Michigan is the 5th highest state at 45. However, Michigan does a lot of genetic sequencing, and they're really actively looking for it at U of M campus in Ann Arbor. They're doing a lot of free testing events, and they're genetically sequencing all of those positive results, really actively looking for more cases. So, you know, we don't know if it's just we're looking for more. We now have it in 10 counties and the city of Detroit. These are really teeny tiny numbers, but you can see there's 23 cases in Washtenaw County, 8 in Wayne County. I think there are 4 in the city of Detroit. no, two, sorry, it's right there, two. And they did find one in Charlevoix. There was a history of travel there. So it is starting to creep. I think this is going to get to be the norm instead of the exception here without too much delay. I know right now we're very accepting of the 10-day quarantine. If you have people that have been exposed to somebody with this variant, we will have them quarantined for 14 days. If they've traveled to a high-risk area, you can consider quarantine for 14 days. I don't expect you to really worry too much about that. We will help make those decisions for you, but things might, basically, I think the take home is just things might be changing, but we're still watching that. So the number of outbreaks, there has been continued increased outbreaks in the state in K through 12 schools. Current new outbreaks, which are ones that were reported between this past Monday and the prior Monday, is 32, and then ongoing are ones that have had, you have to have no new cases reported related to that outbreak for a total of 28 days to drop off the outbreak list. So there's 81 ongoing outbreaks. If you look up here, the high school saw a big increase from 28 to 49 new outbreaks. So, and then so that was the majority of them was in the high school level. So again, that's statewide. I pulled our numbers from the state website of reported outbreaks. So we, in the 19 counties that I'm talking to right now, there are 7 ongoing outbreaks and only one new outbreak. And again, that was a new outbreak that was reported from this past Monday and going back the previous Monday. So in the elementary, there were 2 ongoing outbreaks and 1 new outbreak. The junior high, there was 1 ongoing outbreak. High school, we had no outbreaks in the 19 counties here. And the administration, which is usually like the RESD and those types of facilities, had 4 ongoing outbreaks. So I just wanted to show you that information so you didn't think, our area was doing terribly. We really have quite low numbers, and you can see the associated number of cases. So again, in 3 outbreaks here, there's a total of 7 cases. So again, just wanted to share that. Just wanted to share this. I thought this was some really neat information. This was from the report where the rest of that data, except for the last slide, came from. Just about 12% of Michigan residents have started their COVID vaccination series. Just over 4% have gotten the full 2-dose series. And then breaking it down by age, this is the percent who have started the series, who have gotten at least the first dose. So those over 75, almost 30% of our 75-year and older group have gotten their first dose at least. So I think that's fantastic when you break it down by age. So I just wanted to share that because I just thought it was some interesting information. So I know that was a lot of information. We will get this out to you and or post it on our website, depending on which health department you are located in. I will shut things down here. All right, and then I can go to questions. Yeah, the first chunk of them are all about not being able to see the slides, so I'm really sorry. Okay, so read an article this morning that says CDC is now stating that if you receive both vaccines, yes. So we talked about that. So yes, and it'll be a big help. Again, my big concern is that people will feel like, I don't have to wear my mask, I don't have to stay distant. So if we need to help you with communication on that, let me know. And if you do have anyone who does get a confirmed case and has been fully vaccinated, make sure we know about that too. So, but that is very good news. So we're going to share all of these slides. And again, it is being all updated on the CDC website. But these slides, depending on which health department you're with, either get emailed out to for district. So for Mid-Michigan District Health Department and Central Michigan District Health Department, they eventually do get emailed out to kind of the lead people in your school district. And they also get posted in the school section of the COVID portion of the health department website. And for District Health Department number 10, they just get posted on the school section of the COVID section of the website. And so you can always find everything in those areas. And if you have any issues with getting the materials, you can let me know. So for face covering, is there any updated guidance on allowing, not allowing? So the state and the CDC both just say that it should be 2 to 3 layers, and it should fit snugly around the nose, face, and jaw. So again, in my opinion, if you want to make them not allowed, you can do that. But if that's what they're going to wear, I would just have them wear it folded over so it's a double layer. If they're really, really stretchy, those are the ones that you might discourage more. If people state, that they don't have masks, there are locations throughout the county where they can get free masks, but wearing something is better than nothing or having an argument. And so again, as long as it's 2 to 3 layers, that is considered acceptable. The student has tested positive for COVID in the past 90 days and are now showing symptoms again. Do they need to quarantine? Parent is taking them for another test. Should they quarantine? So it is very unlikely for people to get reinfected within 90 days, but it has been known to happen. And so it is recommended that they get reevaluated by a health professional. Unfortunately, depending on the test that they get done, it is possible that they test positive because of their past infection. And so it can be difficult, but it's basically up to the discretion of a healthcare provider to diagnose them. So I would await what the healthcare provider says. You can wait on quarantining close contacts until you have a confirmed diagnosis, or if someone's a probable diagnosis because of symptoms and exposure. But we have followed that guidance all along, that you don't have to quarantine close contacts until you have a confirmed or probable case. You can choose to quarantine people sooner if you wish to, but from our guidance, you don't have to quarantine people until you know you have a case. With the CDC guidelines saying people who meet the criteria do not need to quarantine, does this mean those people cannot carry and transmit? So if you have someone who's fully vaccinated and they are exposed to someone with COVID, that fully vaccinated person does not need to quarantine. If that person meets criteria for illness, then they need to go into isolation. So I just wanted to make sure we're saying the same thing. We do not really know from the studies that have been done on the vaccine, if the vaccine studies looked at the effectiveness of the vaccines to prevent symptomatic infection. So they gave people vaccine or placebo, and then if people got symptoms of COVID, they tested them for COVID. They didn't, for these 2 vaccines currently out, they did not like randomly test them to see if they had asymptomatic infections. They didn't see, really how contagious were they. So those are the main reasons why we all still need to wear masks and wait until we get good herd immunity and things like that. But the assumption is that because these vaccines prevent symptomatic infection well enough that if they were exposed to COVID, they shouldn't get infected. There certainly is a risk that could they get asymptomatic infection and be contagious? Yes. Is that risk high? No. Is asymptomatic infection as contagious? No. So the hope is that this should be fine. And if something happens, then they'll pivot. But to answer your question in a very long way, no, we don't know for sure if the vaccines do prevent asymptomatic infection or transmission, but we're getting that evidence, and there may be more evidence out there that just hasn't been published yet that I don't know about. Are we allowed to use the 20% venue limitation for our auditoriums to host band? So for the band concert, Tim, I know I am going to reply to you. I re-emailed the state today, and I am still waiting on them to reply. It got forwarded from one person to another, and then today when I asked for the answer, she forwarded it to another person. The question for the rest of you to understand, Section 5 and or it's not Section 5 and 6, it's Part 5 and 6 of one of the sections. It said that Part 6 says venues must abide by the following maximum capacity limitations. It says that stadiums and arenas hosting sporting events, as provided in Section 6, up to 250 patrons may be gathered at venues with seating capacity under 10,000 and up to 500 if they have a capacity over 10,000. For all other entertainment and recreation facilities, no more than 100 may be gathered. And that all falls under the same section as where like band concerts would be and things like that. And so we're trying to find out for schools wanting to have a band concert in a gymnasium, and that's not a sporting event, then, are they not allowed to have as many spectators as a sporting event would? So we are trying to get clarification on that. Again, I keep poking the appropriate people at the state, and they've had some employee changes. Usually they're much quicker than this, but I have your email flagged and I will reply to that, and I will let everybody know that next week I should have the answer. But like I said, Tim, I know you're waiting on that answer, and so I will let you know as soon as I know. I have a staff member who has lost their vaccination card. Can they get their second shot? So everybody's vaccines are also saved in the Michigan Care, what is it? I can never remember what MICR stands for anymore, but MICR, which is a statewide registry. So even if you've lost their card, that is kept in that registry. So no matter where they go, it can be looked up and verified. I believe when they go for that second shot, one of our staff members would be able to make a new card with that first dose record on it and their second dose. I don't know if I have any nurses on the line right now who would want to chime in and say if that is something that they could do if someone's lost their card.
Absolutely.
Dr. Morse, this is Sheila Misaki, and yes, we're able to print them off.
Okay.
Another one.
Okay. So, yep. Parents asking where they should report schools for not following guidelines during sporting events. I would give them that email address that I shared earlier. They could also report to my OSHA, but that's more for employer issues. I would give them, I'm trying to scroll through it. The MDHHS Binax Now request, so BINAXNOWREQUEST at michigan.gov. They should also be able to email just covid@michigan.gov, just the general line. Typically, they are very good about helping people find where to voice concerns and complaints. Can you review any updates to quarantine guidelines, again, for an individual who has received the required vaccine doses? So again, it's just been updated that if someone is 2 or more weeks past being fully vaccinated, so if they got because there will be a 1-dose vaccine coming out soon, so that's why it's a little confusing. But right now it's going to be, 2 doses will be a full series. So if you're 2 or more weeks past your 2nd dose and you get exposed within 3 months of starting your series, you do not have to quarantine as long as you do not have symptoms. Have the projections changed regarding what number may look like going into March while dealing with the variants? It is really hard to say. I know that the thought has been that, at least previous projections were, that the British variant would likely become the dominant variant. But if we continue to do as well as we've been doing at controlling spread, hopefully we'll keep our levels where they're at and keep vaccinating. That's going to be a really big factor. But if we get complacent and think, yeah, we're doing great, so I can start, having big parties or not wearing my mask, doing things like that, kind of like we've had happen in the past, then we're likely to see an increase in cases. But it is really difficult to predict. So I have not seen anything new or different lately. But what was predicted before was if you have it under control and you're vaccinating, there might be a little bump in March, but it was not predicted to be very large. So I may have missed it when I came in late, but what is the direction, not recommendation, that schools are to go with sports spectator limits from your department? So again, this is per the state of Michigan, but there is epidemic order that has the maximum capacity limits for the stadium. And then in the guidance for sports, it is recommended that you limit your spectators to 2 per player. I don't know if any of our health officers are on the call, but I know, and this might be who sent me the email yesterday, but I know we were asked what our guidance was on this. My guidance is the fewer people you have indoors, the better. And so, if you limit it to 2 per player, or 4, if you have a divided family. But, I think ultimately it's up to the school's discretion. But again, from a health standpoint, when you're dealing with COVID, the fewer people you have in an enclosed indoor environment where people are yelling, screaming, breathing heavily, it will be safer. I don't know, again, if any of my health officers are on the phone and would like to chime into that. Maybe that they are busy, but again, it's ultimately the school's decision, but from a health standpoint, the fewer people you have in that setting, the better. And if you have questions, again, you can follow up with the state at that email. Thank you. Sheila was wrote down MICR stands for Michigan Care Improvement Registry. I need to clarify within 3 months. So after 3 months of second vaccination, do they have to quarantine? So as of now, it's 3 months. We don't have long-term data as to how long the vaccine lasts. It should last a lot longer than 3 months. So as we go along, my suspicion is that it'll go to 5 months to 8 months. You know, it'll continuously go longer. But for now, it's 3 months. But again, I can't predict the future. We just have to wait for the evidence to be available to then change those dates. So we just have to follow what we have now and then, you know, adjust as we get more evidence. What are the current guidelines for non-sporting events in our gyms, youth gatherings, etc.? I believe they are pretty much the same. Let me pull up, because that is in that FAQ about extracurriculars. Let me trying to quickly find it here in my PowerPoint. Extracurricular activities are permitted except those where masks cannot be worn. So again, to me, that would mean, and the FAQ section, if you go to the portion of the state website that has the epidemic orders, right in that section, there's frequently asked document. That has a lot of these kinds of questions. But again, as long as they can wear masks and they can follow all the other rules, it appears that they are permitted. So someone's chiming in that the legal group advised that groups outside of school-sponsored groups are not allowed to gather in school buildings. So again, I read the orders and follow what the orders say. If, you know, if legal counsel says something else, that's different. But I read the orders and do what they say. So, or advise how they say. Because there was something in the FAQ about like an aviation class using the building or something. Again, I'd look at the FAQ and, you know, again, use your judgment to interpret it and your legal counsel as you see fit. All right, so I will open it up if there's any other questions on the phone or follow-up, so you don't want to type into the chat. All right. Like I said, we'll get these slides out and oh, I'm just checking the chat again. And we'll get the recording out to the website like usual. And the data numbers. And again, I'm working on those follow-up answers with the state on the gathering. Oh, there's a raised hand. Not a genius with. I really don't like Teams, if you guys haven't found that out yet. Again, I see someone has a raised hand, but I cannot for the life of me. Okay, Lynette.
Lynette, I think it's Lynette, yeah, Gardner.
I don't know if
no,
Lynette's still on.
We can't hear you, Lynette.
She's still on mute. All right.
Can you hear me now?
Yes.
Oh, okay, good. Sorry. My question was, and maybe this got answered because I joined late. All our COVID plans are dictated toward the phases. So as far as when people ask us if we're going to make changes, seeing the different changes, you know, coming in from the guidance from the state, how do we answer that if we don't see anything talking about the phases anymore?
So one thing is we do have the phases still. So when I go over the data points and those different colors, the A, B, C's, D's, and E's, those are the phases. But there are different, I know that there's a different phase that they had used before. The phases that they talked about is the roadmap initially.
Mm-hmm.
Were those the phases you were talking about?
Yeah, because like we say that we don't
Yeah.
allow parents to come inside the building because we're still in phase 4. So they're like,
Okay.
well,
Yeah.
when are we getting to phase 5?
Yeah. Yeah, so those have kind of gone by the wayside. The newer guidance the state put out early part of the year, it was kind of an addendum to the roadmap. It really specifically stated in there that following numbers and metrics and things like that were no longer part of the decision making. And I can forward that to you, but that was something that they had made. Really, part of that was to help the schools that were not face-to-face to get to face-to-face.
Okay.
But they really clearly said in there that, using like positivity and cases per million wasn't, like having that metric wasn't really indicated anymore. But in terms of the phases, I don't really even know where that lies anymore. It just seemed to kind of go away.
Okay. Just because several of our decisions were tied to those phases. So that's where parents are like going, well, can we come back in the building now? Can we not? Are we still stuck outside? That type of thing. So that's why I was just trying to get clarification.
Yeah, I know. Yeah. Yeah. I know those phases were really set by the governor, whereas the ones that I share each week, those are set by, the epidemic data. So, yeah. Any other questions anybody has? All right. Well, I think if I look at the calendar, we're on for next week. And if you have any questions in the meantime, let us know.
Thanks, Dr. Morse.
Yeah. Have a good week, you guys.